Welcome to Health Bulletin. Scotland is on the brink of a medical milestone, reporting a groundbreaking victory in the fight against cervical cancer. Thanks to the HPV vaccine, the number of cervical cancer cases among vaccinated women has dropped to 0. It's a big step towards making cervical cancer a thing of the past. Since the vaccine's introduction in 2008, Scotland has seen a dramatic turn. For those vaccinated at 12 or 13, cervical cancer has become virtually non-existent. And for those vaccinated between 14 and 22, the rates have drastically dropped. Before we move forward, if you're finding this content helpful and informative, please consider hitting the subscribe button below and stay updated with our latest medical videos. A study looked at cervical cancer cases since 2008, when the HPV jab was first introduced. There were no new cervical cancer cases reported at all. The vaccine, combined with regular screenings. Women should be screened for cervical cancer every 5-10 years starting at age 30. Women living with HIV should be screened every 3 years starting at age 25. The global strategy promotes at least 2 lifetime screenings, using a highly effective HPV test at ages 35 and 45, paving the path for cervical cancer to become increasingly rare. As of 2023, there are 6 HPV vaccines available globally. All protect against the high-risk HPV types 16 and 18, which cause most cervical cancers and have been shown to be safe and effective in preventing HPV infection and cervical cancer. As a priority, HPV vaccines should be given to all girls aged 9-14 years before they become sexually active. The vaccine may be given as 1 or 2 doses. People with reduced immune systems should ideally receive 2 or 3 doses. Some countries have also chosen to vaccinate boys to further reduce the prevalence of HPV in the community and to prevent cancers in men caused by HPV. The NHS wants to boost uptake of the vaccine among young people. The current mission? It's set on eradicating cervical cancer by 2040. HPV, a widespread virus consisting of over 200 related viruses, is responsible for genital warts and various cancers. The vaccine is designed to guard against HPV, shielding individuals from its harmful effects. Some strains lead to genital warts, while others can instigate genitourinary cancers. A breakthrough has arrived, a more affordable, 1-dose HPV vaccine, a beacon of hope for low- and middle-income countries where the battle is hardest hit, where 90% of the women who die from cervical cancer live to this preventable disease. 340,000 women die from cervical cancer in the prime of their lives every year, and 600,000 women get cervical cancer. And we have a very simple tool that can prevent this: HPV vaccine. Women spend 25% more of their lives in poor health than men. Closing the global health gap is more than a necessity, it's a duty. With women facing 25% more life years in poor health than men, the ripple effect of this vaccine extends far beyond individual health, promising a boost to the global economy by $1 trillion annually by 2040. The urgency couldn't be clearer. The HPV vaccine is more than a medical advancement, it's a lifeline. What other solutions can we explore to bridge the global health gap? Share your suggestions in the comments below. Thank you for watching. And if you enjoyed this video, don't forget to subscribe to our channel for the latest in medical breakthroughs and health alerts.